Hi, my name is Kenzie Vo, and I'm going over the structures, functions, and diseases of the eye. The human eye is a complex sensory organ which affords sight and other associated capabilities. Vision provides the ease of daily tasks and many other functions which support an independent and colorful life. Eye health is promoted through proper nutrition, protection from UV sunlight, avoiding toxins, and healthy lifestyle choices. One of the largest factors that attributes to poor eye health and vision acuity is the unavoidable process that is aging. Eye development occurs in the human embryo from approximately the third week through the 10th week of gestation, which is supported by the mother's availability of lutein and zeaxanthin. In the aging adult, lutein and zeaxanthin have been shown to reduce the risk of chronic eye disease and development of new cataracts. Three of the most common diseases of the eye include age-related macular degeneration, cataracts, and glaucoma. Vitamin C, E, zinc, and essential fatty acids, such as omega-3, play an important role in promoting and sustaining health of the eye. Main structures and functions. Anatomically, the visual system is made up of the orbit, the ocular adnexa, the eye, and the visual pathway. The ocular adnexa are made up of the external tissues and structures that surround the eye, and the visual pathway that supports vision is done so through the structures that are the optic nerve, which is over here, the optic chiasm, which you can't see on this because it innervates through the back of the head into the brain and down the spinal cord, the lateral geniculate nucleus, and visual cortex. The bones that surround the eye and hold as a housing for the eyeball, otherwise known as the eye socket, is called the orbit. There are many bones in the face and exactly 7 that form the orbital bones. These bones fit together like puzzle pieces and travel back to the most posterior end of the eye socket. The frontal bone, the zygomatic bone, the maxillary bone, ethmoid, sphenoid, lacrimal, and the palatine bone. The main structures of the eye include the sclera, the cornea, the pupil, the iris, which is right here, the lens, the macula, back here, the optic disc, and the optic nerve, also known as cranial nerve number 2. The sclera is a protective layer attached to muscles which allow the eye to move. The cornea allows the eye to reflect light and focus light so that one can see near and far. The pupil sits inside the iris, which is the entry point for light, and it uses pupillary muscles to dilate, regulating how much light should enter the eye. As light passes through the lens and hits the retina, the macula translates the light into images, which is then responsible for central vision that lets you see objects directly in front of you. The optic disc and the optic nerve are receptors that translate and deliver visual information into the brain, allowing the viewer to possess sight. Age-related macular degeneration, cataracts, and glaucoma. 3 common conditions of the eye that can induce vision loss, decline visual acuity, and limit independence amongst those who suffer poor eye health or in the later chapters of life. Age-related macular degeneration, or AMD, blurs central vision. Cataracts creates poor night vision, and glaucoma may be partial or complete blindness. AMD. The macula is responsible for producing clear and sharp images in the eye, which is back here. Disease and degeneration of this structure can cause blurring and loss of central vision. The macula is part of the retina, which is a light-sensitive tissue at the back of the eye. There are 2 types of AMD, dry and wet. Dry is when the macula becomes thinner, and wet is when the occurrence of abnormal blood vessels grow in the back of the eye, damaging the macula. AMD can come on suddenly with no warning signs, or it can gradually become worse over time. Clinical manifestations include inability to or a difficulty in seeing things up close, trouble with driving, and not being able to see distant objects. AMD affects central vision, so signs of disease progression will appear as though one cannot properly focus on an object in the line of sight. There are currently no treatments to correct AMD. However, management and prevention of worsening symptoms is done through regular eye exams, proper nutrition, cessation of smoking, and an active lifestyle which promotes exercise. The progression of wet AMD AMD may be slowed through medications called anti-VEGF drugs and photodynamic therapy, PDT, which is thought to inhibit the production, leaking, and symptoms of new abnormal blood vessels behind the eye. Nursing management may include support in finding new ways to do activities of daily living. Impaired vision loss can be dangerous for adult and geriatric populations. A nurse can coordinate patient care with an optometrist and occupational therapist to help the patient adjust to the change in vision. If a patient were to have laser done on their eyes to treat AMD, a nurse can afford the patient valuable resources for treatment post-procedure. Health promotions for teaching clients about proper nutrition may help prevent worsening of the condition. A nurse can encourage a patient to improve their diet or exposure to toxic chemicals that may be harming their health and thus their vision. Cataracts. Cataracts affects the lens, which covers the eye, causing it to become cloudy. This is due to the breakdown and buildup of proteins which normally exist in the lens. Clinical manifestations include blurry vision, faded colors or inability to see colors as vibrant as once before, trouble reading, seeing halos around light, photosensitivity, trouble driving at night, and double vision. Diagnostic studies which test for cataracts include a visual acuity test, a slit lamp test, dilated eye exam, and tonometry. Treatment and management are done through surgical removal of the damaged lens with the replacement of a new artificial lens called an intraocular lens. A new prescription for eyeglass lenses may be helpful for early stages of cataracts. Using bright lighting, magnifying glasses, and anti-glare sunglasses are also helpful for those who do not want surgery. Nursing management may include helping the patient reach goals such as lifestyle adjustments. Such adjustments will include the use of prescription glasses and sunglasses, better lighting at home, and regular eye exams. Nurses can support patients who have surgery to replace their lenses by encouraging them to take their time healing and use precaution when reintroducing activities of daily living. Health promotion for teaching clients about ways to improve their diet and health may include foods that support eye health, the use of sun protection, and eye products such as lubricating drops. Glaucoma. Glaucoma affects the optic nerve or cranial nerve number 2. The optic nerve transmits visual information from the retina to the brain, and damage to this nerve can cause vision loss and blindness. Clinical manifestations include gradual peripheral vision loss and ultimately total blindness. Glaucoma happens so slowly that most people do not notice their vision changing. Scientists believe that increased pressure in the eye may be responsible for glaucoma. Treatments that lower intraocular eye pressure or ocular hypertension are used to help slow the disease. Diagnostic studies done for glaucoma include a dilated eye exam where the ophthalmologist widens the pupil and inspects for signs of glaucoma. The patient is also given a visual field test to assess visual acuity. Treatment and management are done through medication, laser treatment, and surgery. Neither of these options can reverse damage caused by glaucoma, but they can prevent further injury to the eye. The most common treatment for glaucoma is eye drops, which lower the pressure in the eye, protecting the optic nerve. Laser and surgery are available to help drain excess fluid from the eye. It is important to have regular eye exams which assess for glaucoma and other diseases of the eye. Nursing management for patients with glaucoma include informing the patients on how to use their eye drop medication, ways to remain safe with impaired vision, and the providing of educational material regarding glaucoma. It is helpful for a patient to feel supported at vulnerable times such as these. Therefore, encouraging a patient to establish care with an eye doctor can prevent further damage and possible falls and accidents at home or within the community. Health promotions would include educating the patient on ways to manage symptoms of impaired vision through using medication, wearing appropriate eyewear, avoiding tasks that are contraindicated with glaucoma, and possible side effects of the medication. Educating the patient on ways to prevent falls and accidents is important regardless of the eye disease. Promoting the use of a life-saving device, such as a necklace that alerts a call center when someone has fallen, is important nurse teaching that should be addressed. In addition, it is crucial to ask the patient or family members to inspect the home for possible fall risks and to install proper lighting. Adjusting to life with compromised vision can be emotionally tolling and physically disabling for patients. Educating patients on how to adjust is an important role for the nurse. Thank you.